Alright, so I just wanted to share with you guys real quick how I take my report before I start a shift. So when the outgoing nurse is leaving and I'm coming on and I'm taking a report for the first time on a patient, this is exactly what I do. Okay, so first thing I do is I just grab a blank sheet of paper and a pen, okay? And at the very top of the sheet, I'll write the patient's name. And then I'll write age and gender. Okay, so for example here, let's just get a fresh sheet here. So example, I would do like Mr. Jones, 54-year-old male. And then next to that, I'm going to put code status, full code, no known drug allergies. And then I'm going to put what the doctor's names are. So let's say it's Dr. George. And let's say it's the intern. So that allows me to know exactly who I'm going to be calling during the night if something goes wrong. And this lets me know the basic information about them. Right below that, I'm going to put their medical history, so past medical history and past surgical history. For some patients, I don't care as much about that, but for a lot of patients, I'm going to care about that, like if they're a heart failure patient or if they have some sort of history that I need to be aware of throughout my shift to be able to take better care of them. So I'm going to put that right there, and then after that, I'm going to put the situation. Okay, so for example, the nurse will tell me, came in or found down 3 days ago. Family arrived, saw the patient down, called EMS. EMS brought them in, found the patient had a big subarachnoid hemorrhage. They placed a ventricular drain. So I'm going to write all that right here. All that's going to go here, and I'm going to write exactly what's going on. Okay. Then after that, I'm going to do a systems report. So that means I'm going to start at the head and work my way down through the body. And write the pertinent information about exactly what the patient is doing right now. Okay, so for this part of the report, I don't care what they did 3 days ago. I don't care what we hope they do. I care exactly what they're doing right now, so that when I go in there and walk in the room, I know if there's been a change based on what the nurse told me. So I'm going to start neuro, and I want to know how oriented they are. I want to know what they're moving. I want to know if they're having any sensations. I'm going to want to know pupils. I'm going to want to know all that type of stuff. So we'll say A&O times 4, Perlas at 4, moves all extremities, follows commands, etc., etc. So that's going to be my neuro. After neuro, I'm going to go cardiac. Okay, so I want to know what's their heart rhythm, what's the rate, what's their blood pressure trends, do they have any medications to control their blood pressure? So we're going to say sinus rhythm, let's say elevated BP, they have nicardipine, for systolic blood pressure of 140, and then I want to know IV sites, and I want to know if they've had and what type of fluids they have going. So let's say they have a right IJ triple lumen, right IJ triple lumen cath, and they have NS at 75. Okay, so after we do cardiac, the next thing I want to know about is I want to know about respiratory. So I want to know how they're breathing, if they're getting oxygen delivered to them, what their lung sounds are like, if they have any secretions. Okay, so those are the things I want to know. I want to know mode of breathing, secretions, and I just want to know if they're labored at all. Okay, if they were extubated, if they were just recently extubated, I want to know when they were extubated and how they handled it. Okay, after that, I want to go GI/GU. So I want to know their diet. I want to know if they're dialysis. I want to know when dialysis is. I want to know if they have blood sugars. I want to know how they're urinating. And that's kind of basically, I want to know what's going on in their stomach and in their urinary system. And what do I need to be aware of more than anything, okay? So after that, I'm going to do skin. Here I want to know surgical sites. I want to know any pressure ulcers. And I basically just want to know what their skin is looking like, okay? After skin, I want to know I want to know the plan for the patient. What's the plan? Are they going home tomorrow? Is social work seeing them? Are they supposed to have any tests being done or anything like that? So that's what my report's going to look like. I know that looks impossible to read. That's kind of what mine would actually look like in real life. Below that, what I'm going to do, below at the very bottom of my page, I'm going to divide it into 2 sections. The first section is stuff I need to know, and the section over here is going to be meds. Okay? So under stuff I need to know, I'm going to do like my blood sugars are Q4, I have a CT in the morning, and any special labs or tests that I might have. Over here on meds, I'm just going to organize my meds by the time they're due. So my 2000 meds, my midnight meds, my 4 o'clock meds, my 6 o'clock meds. And I'm going to write them all out so I know exactly what to do each hour of my shift. Okay, guys? So that's basically how I take report. The best way to do it is a body systems report, and then to make a place for you to know exactly what you need to be doing during your shift and the plan for the patient. All right, so that's just a quick way to take report. It's the way I like to do it. It's the way I like to give report. If you have any questions, you can always reach me. Contact@nrsng.com.